Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our third GIS complications. So we're going to start with Speaker of the Board, President Fawaz Al-Mutairi, to welcome you. Then, inshallah, we'll go to the program. Dr. Fawaz.
Good morning, everybody. We are so delighted and I'm happy to extend a warm welcome to you all in GIS Complication Cases Show, the first activity of GIS in 2024, organized by the Gulf Interventional Society. And this event aimed to highlight the experience and success of interventionists from Gulf and MENA region as they shared their knowledge while addressing the complication. This year, GIS is expanding its horizon and range of activity, including GIS complication, GIS valve, and developing a project like artificial intelligence program, leadership program, and annual conference in November. At the core of GIS mission is a gathering of the efforts, opinion toward common goals that serve the public, state, and healthcare professionals, with the focusing on scientific research and society compatibility. As an integral part of Gulf Heart Association, GIS is dedicated to encourage national and regional interventional cardiology joint society, fostering cooperation between regional and international bodies in the field of cardiovascular intervention. It's essential for GIS founder and members to recognize their responsibility toward patients, society, fellows, physicians, and other health care professionals. On this occasion, we are excited to welcome you all to GIS Complication Show, where we promise to provide the most advanced science and technology in the field. And that will take me to a special thank to my great friends, Dr. Abdullah Shihab and Dr. Musa Akbar, who is behind all of this success in GIS Complication and Cases Show. And they are the course organizer. They did a great job on getting all this together, formulating a great program that will take us to 2 days of fruitful of scientific material. And also we'll extend our thanks to our great company and sponsor for this activity. This slide, I hopefully we can see it now. It just to show you that our extensive activity all over the year in 2024, some of activity we continue to do the same, like GIS complication, valve, an annual meeting, and academic activity like leadership program, artificial intelligence, and intervention and training modules. And also this year we'll start a new project called GIS Expert Studio. Will be hybrid between virtual and physical, and we'll explain it later on as we go through the program to you. So I'd like to thank you all for being with us today. I'd like to thank you for being members of GIS and part of the family of GIS Complication Cases Show. And with this, I would like to hand the mic to Dr. Abdullah Shihab and Dr. Musa Akbar, the course organizer of this meeting.
Right. Thank you very much, Dr. Fawaz. Okay, normally we start our sessions with an overview and just to warm you up. And this is every time we add some few presentations. Can we start with our presentation, or I have to do this? Do I do it? Or you do it? Okay, you do it. Great. Okay. Right, so just if we go back, Musa Akbar, so we go like 1977 when this intervention started. And of course, when you start with anything new, you anticipate some problems, some complications, that's why we are here. And then, of course, we have a leading now GIS nowadays, as you can see, of valve by Dr. Fawaz, and the same problem. So if we look at the complications happens, that's normally people compare it to aviation, compared to auto, which is, I don't think it's fair. But you can see the numbers is nothing compared to the airplane crash, which is, happens very, very rarely, but complications is there, but it's not that common. Can you remove this? Yeah. Don't play with it. Leave it for me, please. Leave it for me. I'll touch it, okay? So medicine doesn't, does not equal to the automobile, transport, or aviation. So we are human beings. When we start with a sick person. That person coming to us is not, so we have to have some kind of discussion before we, and it's common to have a problem. And when do you expect? Most of our patients nowadays are having lots of problems. And especially, these are the people you have to think about complication. If it's not going to happen, it might happen to some degree. And of course, the anatomy we're dealing with nowadays, things are increasing. And of course, the clinical presentation, which you're going to see today and tomorrow. And of course, the things we do nowadays, combined CTO and the rest. So as our experts, normally Antonio Colombo says, which is, he's right, it's very rare, but if not done enough, of course, you will not see it. So you've not done enough cases, you'll not see this. So that's why the experts like you are here to share these things together. Of course, diagnostic have got complication. Of course, intervention got complications, and this varies and start from maybe something disability like a stroke to death, which happens. I think most of us have seen it with our patients. But how can we minimize that? I think that's something we can learn together today as well and tomorrow is communication with our patients is to in the right way and right information. I think that make things more smoother away from the court. Nowadays, lots of things happening regarding that. And we always to give alternative. That's why you see people talk about bypass and or medicine, not just intervention. So we need to remember that. So unless we admit we had done an error, otherwise it will become a mistake. So we need to admit that. Starting from, we're going to learn that we have access problems, which we've seen, and we have perforation. We're going to have lots of talks on that and how to deal with that. And of course, the reason for that are many. I'm not, this is going to be discussed, whether that on a MI or during CTO, you're going to see that. Of course, the time is important, but you have to remember when you see a perforation, we're going to discuss to remember these things, which I'm not going to discuss now, and of course how to deal with it. It's all going to be that's why I'd like to stimulate you, because these 2 days are going to be discussed in details, these things. I'm going to show you, but we have an expert, Muhannad, is coming here to give a workshop here, and I think outside there. Me and Dr. Musa and Fawaz thought about this. In addition to presentation, we have to have something something practical, people go out with it. So that could be discussed, inshallah, outside. Dissection are many there, and me and Musa, when we're putting the program, dissection is fine, but there's bad dissection as well when it happens to the, iatrogenic to the aortic, and then result either medical or surgical, and that can also be discussed. And how to deal with that. Of course, the incidents are low, but how to manage that, I think, is an important. No reflow. We're going to start with no reflow this morning. What's the reason for that? There is, the concept of that changing. Time is important for that. We're going to learn that, of course, and how we thought about. Sometimes we use these tools, sometimes we forget them in the body. How to deal with that? I think that's an important concept. We're going to discuss that as well. So I'm not going to, then of course, the things which is, we for sometimes we are not vigilant, we do that, of course, and the structural, of course, not to forget we have problems, and that some of that will be during the case show. We thought, me and Dr. Musa, about that. So remember that you have a cath lab, and remember that you have all these in your room, either in your room or in the cath lab, and numbers to know. This is, I think, it's important. And of course, the TAVI, I think, some of the complications will be discussed as well during this. So how to talk to your patients about the complications, I think, and the family, I think, is important for them to know before, so to avoid the court. And we, as a physician, as a team, how to think to move from the cult leader to a learner, not to be humble, to be listening to others, not just blame others, not to point things to ourselves as well. I think surrounding yourself with the right people, I think that's the way to go forward. So moving from, accepting failure to denying the failure. I think that's important to grow. You know, if you don't fail, you will not grow. Okay, so we need to, of course, learn. And the two minders, I think this is important things we're going to learn during these 2 days. Not just think about anatomy, think about indication and fear of failure. We should move forward and to be a referral and a proctor. And when depend on others in order for us to be fully who we are, the concept of, I want to all know a person is a person through other persons. And of course, to be vigilant, to be on time. When you are in the cath lab, to be on that time. Don't think about future or the past, because, and then this is going to happen in these 2 days. We're going to watch something happen in front of us. What's supposed to happen? What can we learn from it? And why was there a difference? I think this is the castle way of go forward. So never hang with one candle. Be together, I think we're going to reach. So I think in that way, inshallah, we'll go forward. So I'll leave now Dr. Musa Akbar to lead the first session.
Thank you. Thank you, Dr. Abdullah. Thank you. Thank you very much. Good morning, everybody. It's really a great pleasure to have you with us in this GIS complication. I'm not going to talk more, just historical background behind this. In 2018, we have started the complication in a very small room during the annual conference, and I was involved from beginning in this program. We found a lot of people in the small room, so I raised the concern that we should expand it. So, and then a year after that, we expanded the room into 2 rooms, and then in 2020, just before the COVID, we had it in the main arena on Saturday for the whole day, for almost the full day on the Saturday. Then we decided on 2021 that we should go in the dedicated program, which we did. And I appreciate and actually thanks the executive board and Mr. Chairman, Dr. Fawaz, who gave us a support to do it in dedicated program. And this is a unique program. Myself and Dr. Abdullah, we worked on it since 2022. So this is the 3rd year in a row of this program. And each year we developing a new concept, a new topics. And we are very glad that this is a unique in the Gulf and perhaps in the Middle East. There's no other society or organization do such symposium or conference on dedicated complications. This year, myself and Dr. Abdullah, we decided to add more, so we expanded the cardiogenic shock. Tomorrow we have 1.5 hours of cardiogenic shock. For the first time, we expanded the duration of cardiogenic shock. We put a lot of the cases as well as the scientific material. And for the first time also, we introduced the aortocoronary dissection. That was not in the previous 2 years program. This is the first time. So every year we sit together and develop a new things and introducing a new topic to be discussed. And we worked hard, so I appreciate the ICOM who have been with us and they did this program through the meeting, through the virtual meeting, myself and Dr. Abdullah, to put this program that you see it over the past 4 or 5 months. So I'd like to thank Abdullah Shab, my colleague, and executive board, Dr. Fawaz al-Tayri and Khalid, for supporting us to do this program, and inshallah it will be very successful and fruitful with your presence and your contribution to this program. So by this I end up my talk, and thank you, and we'll start our program. Thank you. Now